We have a health system across 4 states: Oklahoma, Kansas, Arkansas, and Missouri. And as a result, there are many rural communities, and we cannot get the same level of services in the big city as we can the small rural places. So it's about driving care close to home, so that I, as a member of that community, don't have to drive 3 hours to see a neurologist or an endocrinologist. I can get care directly in my local town without having to go anywhere. So the grant purpose is to deploy telemedicine equipment in clinics in small locations so that they could see any type of physician near home. It's two-way audio video. They place a patient into a room, and it's usually an exam room or a hospital type setting. It could be in the ED, or it could be in the any room that we kind of build out, but it reminds you of a patient's or a physician's office. And from that, we have a screen on the wall, and that screen on the wall, you'll see the physician or the provider come through via video. You see the physician's face on the screen, and then you have either a nurse or a LPN or some kind of medical assistant that's assisting the patient in the room, and they actually do the whole patient visit with the patient or with the physician being on the screen. We're actually building a model that no matter where you need care delivered across the continuum of care, that you can get that close to home. So whether it's I need a specialist and that I need to see a neurologist nearby, or that I land in the hospital, we can connect to you via being in the hospital, or eventually as we drive this to the home, you'll be able to actually have some of your patient care visits right from your home, whether it's through an iPad or your home computer. Still being all fully secured and encrypted, making sure that patient privacy is maintained through that process. We started with TeleICU back in 2006, and we have 500 patients that we're monitoring from an ICU level in 28 different hospitals across 5 states. So that's kind of where we started, but now, based on what we've learned from telemedicine from there, we are now able to drive it in many different directions. So we right now have about 70 telehealth projects that we're working across the health system. So it could be anything from pediatric endocrinology to telegenetics to e-lactation to sitting for a patient to keep them in bed, infectious disease consults, cardiology consults, you name it, we're dabbling into it, pastoral care. We're also doing video translation. So wherever there's a need, we find a way to bridge that gap with telemedicine.